Okay, welcome everybody. Thanks so much for joining us today. My name is Dr. Jeffrey Puglisi. I'm a concierge internal medicine doctor in the lower Fairfield County area in Greenwich, Connecticut. I've been there for the past 19 years, and it's really my pleasure and honor to introduce two new practitioners to the area in Fairfield, Connecticut. One is David Potucek, who's a manual physical therapist. David, how are you today?
I'm good. How you doing, Jeff?
Great, thanks for joining us. And the other is Dr. Bojana Jankovic Weatherly, and Bojana has been in practice in New York City, but most recently moved up with her family to the Fairfield, Connecticut area. And we'll talk a little bit about her functional medicine training and her internal medicine background in the future. But Bojana, thanks so much for coming today.
Thank you. Thank you so much for having me. I'm excited to have this conversation.
Absolutely. One of the ideas that David and I were talking about, because I'm a patient of his, out of all candor, and have been for many, many years. We've known each other for about 15 years. One of the ideas that came about when we were talking about doing a podcast webinar series like this is to really try to simulate what a lot of practitioners have in their practice, which is multi-specialties within their group. So you go to one internal medicine doctor, for instance, and down the hall is a cardiologist and a pulmonary doctor and a physical therapist, et cetera. That's getting harder and harder to replicate these days. And so what we thought about doing is, why not have that connection amongst practitioners in the area to really get optimal patient outcomes, whether it's a physical therapist like David, a functional medicine doctor like Bojana, internal medicine doctor who can be the quarterback going forward. And we thought that it would be great to introduce all of us to the community at large so that you can test and see if we're right about that theory. And I truly believe that we are. Let me dive in first by introducing both of you. David, you've been in physical therapy for the past 15 or more years. You had your training initially at Springfield, Massachusetts, and then went on for more, and you'll talk a little bit about it in a minute, because I think it's what differentiates you, more functional training, manual functional training at the Institute for Physical Art in Steamboat Springs, I believe. And then you've had your own practice in Connecticut in the Fairfield area for the past 2 years. Give us an idea, if you could, about what it was that prompted you to go into physical therapy in the first place. What life circumstances brought you there? I know that you were a Division I athlete. Maybe you can talk a little bit about that. And what prompted you to really get to this point in your career?
Yeah, so I was a gymnast for 17 years. Did that in Springfield College, made Division I nationals on rings and vault. Was a pole vaulter. I mean, we dabbled in almost every sport possible when we were young. So always liked the human body and how it works. And so, had some thoughts about going into medicine and being a doctor like you guys, but didn't want the 8 years of schooling and residency afterwards. So did a few hours at a physical therapy place, and always knew I wanted to help people. And so I was still in medicine, which I really enjoy. And grew up basically fixing cars and, building bikes from parts and things like that. And so, fixing people was like the next step. So went to Springfield College and then graduated and worked up in, I'd say, Shelton area and, upper Fairfield County for quite a few years. Ended up down in Greenwich for about 10 years, and then went through a training called functional manual therapy through the Institute of Physical Art in Steamboat Springs, Colorado. And it's an advanced training in hands-on techniques, which just get us better outcomes quicker with patients. And then bounced around a little bit after that and decided to open my own practice, and have been in Fairfield for about 2 years now, and really enjoy and have my own practice. So
That's fantastic. I actually looked up the institute that you were talking about, and one of the quotes that they have there is, they train physical therapists to think and observe in a three-dimensional way to understand cause and effect of why someone might come in with the injury. And it actually dovetails into what Bojana has been doing too in terms of functional medicine. One of the hallmarks of functional integrative medicine, if people don't really understand that, those buzz terms, is to understand why the disease is there in the first place, rather than here's the medicine to help with your symptoms. And I think that's something that is missed. And truly, if I went back 20 plus years to my medical training, I would love to be educated in that way, rather than just disease X gets treatment Y and next patient. So perhaps, Bojana, you can give us a little bit about your journey. I know you came through a couple of different regions, the University of British Columbia in Vancouver, and then an epidemiology stop at UCLA your residency at Cedars-Sinai, and then an integrative medicine fellowship with Dr. Andrew Weil, which many people may know, in Tucson, Arizona. You opened your practice in New York City and then came up to Fairfield. Give us some thoughts about what led you to this profession and why you changed gears a little bit from the traditional medical training.
Absolutely. So I knew I wanted to be a doctor very early on. I would say probably in my early teens. I was just fascinated both with all sciences, and I loved working with people, helping people. I would always be volunteering either in a hospital or a senior home or with children or tutoring or some level of hands-on working with people to get results, to get some sort of positive outcomes. And so the science and the love of working with people just sort of naturally blended for me. But I never in a million years dreamed that I would be pursuing integrative medicine and functional medicine training, nor did I really know what they were when I entered into medical school. And so my track was sort of, I did my undergrad in biophysics honors, I did a master's degree in cancer research. I really thought about becoming a clinician scientist, and then thought, okay, after undergrad, master's, medical school, do I really want to go back and get a PhD, or do I want to kind of finally just start working and do my residency? And so that was the reason that I kind of went, even though I love research and I am constantly looking up studies, but anyways, decided to pursue the clinical route. And, it wasn't long after I started practicing as a primary care physician that I realized that there's that patients that were either being seen by integrative and functional medicine doctors were getting really interesting outcomes or an interesting point of view about something that I had no training on. And I just realized that for my chronic patients that I was seeing, whether it's chronic fatigue, whether it's anxiety, depression, hypothyroidism, and that 5 to 10% of the patients that don't feel better when you treat them with thyroid hormone, I was always curious as to why. How can I help them? How can I support them better? And this is really when I started looking into the integrative medicine fellowship that one of my colleagues actually at Cedars-Sinai had gone on to do the fellowship a couple of years prior. And so I started researching it. I heard Dr. Andrew Weil speak at a meditation retreat, actually, which is when I also got into meditation and mind-body medicine and started exploring mindfulness-based stress reduction. And this world, I just thought, is so misunderstood, maybe in some ways, but also underutilized in our conventional medical setting. And so rather than saying, I'm purely a conventional doctor or I'm purely functional, I really do combine the best of all worlds. I still am an evidence-based physician. I will still recommend modalities that have scientific evidence behind them. But at the same time, I am so fascinated, as you mentioned earlier, Jeff, and you, David, as well, about the root cause and really the problem solving and critical thinking of medicine. And I think that's the piece it's like really exciting to me, to get a very complicated patient and try and figure out what is going on. How are these pieces of the puzzle connected?
I totally agree with you. And something I read on Dr. Weil's website was part of their fellowship is geared towards re-energizing, restructuring, and reframing a perspective. And I think that's what you're getting at, is seeing the same patient with the same symptoms, but looking at it very differently with a different prism. And I know for a fact that that's what David does. And the difficult part about the individuals watching this program right now and wondering if seeing David for their injuries or their chronic maintenance of different issues related to posture and athletics and years of abuse, perhaps from sports, is that David, it's all about the way it feels when you're doing the work. And I've been to many physical therapists over the course of time with an athletics background. And the moment that you worked on me, and I remember it distinctly, it was probably about 10 years or more ago. And I went up to see you and I said, my shoulder's killing me. I was playing too much golf, and 90% of the visit was focused on my neck. And I kept thinking to myself, this guy doesn't know what he's doing. My shoulder's what's bothering me. What's he working on my neck for? And really what it told me, and it taught me a valuable lesson, is that you can go after the actual problem that the patient came in with, or you can fix the situation that caused the problem in the first place. David, maybe just go through a little bit about what differentiates you from the traditional physical therapist, why you went on for further training and just discuss a little bit more about what I was getting to, so that patients can really feel comfortable with taking that deep dive into a different way of looking, a different prism of looking at caring for patients with physical and sports-related injuries.
Yeah, so originally I'd worked at the big box places, or mills as we call them, and you're one of 4 patients that the therapist is seeing at the same time, and you're basically just throwing protocols at patients because that's all the tools that you have at that point. And so the quality of care is a little different, and it's just more of a shotgun approach of like, hey, let's just try this because that's what we do with everybody. And so I wasn't happy with the outcomes that I was getting over times. And so I wanted to learn, well, how do I fix the patients that, can't be fixed by these protocols and normal things? And so then went on to learn training, in which I, increased the number of tools in my toolbox from 10 to hundreds. And so the ability to pick those tools and then break a body down into like parts of, well, how is your neck related to your shoulder and how are they interconnected, and be able to assess and find the root cause of the problem was one of the things that we developed over time. And so being able to find, whether it's a tight muscle, a nerve issue, a visceral issue, just a weakness. And so having that skill set and assessment set to find the actual problem was one of the things that I really worked at over time, and differentiates me from just that shotgun approach with protocols.
Is there a difference in terms of the time frame? You mentioned that many physical therapists, I'm sure we've all dealt with this in the past, I'm sure they would all love to have a long period of time to take care of each patient, but in the factory-driven model of where you're only getting paid for the number of patients that you're seeing, it's kind of why my practice shifted to a yearly fee-based concierge practice, so that you're not rewarded, so to speak, for seeing a volume of patients and giving slightly less significant care. You're rewarded by giving great care to patients who value their health. Give me an idea of what the actual visit feels like and looks like. How long are you actually treating patients? What are the common problems that you see? What are the misconceptions perhaps about what you do versus a physical therapist? My presumption is that you're out of insurance, so patients are paying out of pocket, which may be a barrier to get them in the door to see you, or to have practitioners in your area really see the value and the utility of having you involved in their patients. So give me an idea of those specific patients that come in all the time that really get benefit from you.
So sessions are an hour long, which normally in traditional PT, you see somebody for about 15 minutes out of that because there's multiple people there. And so one of the main things that just lets me have the time to find that root cause of the problem, but it lets me treat multiple body parts at the same time. And so if you go to traditional PT, you may have one day where they spend on just your back, one day on just your shoulder. Well, since I have a full hour to treat you, I can treat anything you want. So a lot of times I may end up treating a neck and a shoulder and a knee and an ankle all in one session because I have the time. And so when we treat systems instead of parts, then we often get a lot better results, because then I'm treating you as a body and not just a piece. And having the time to be able to do that is one of the key things. And so the majority of most sessions are hands-on treatment. So whether it's, mobilizing a joint or a tissue or getting a nerve moving, and then we spend a part of it on like postural education and then which exercises to do. One of the things that differentiates me is I do a lot of muscle testing, and much more than your standard physical therapist or even normal PT, because I've somewhat integrated my own system. And so the average muscle test would probably be like 6 per joint. Well, we can do up to 30, because what I'll do is I'll add in PNF patterns or diagonals, but then I'll also muscle test in a short range, a neutral range, and a long range. And so it lets me find weaknesses that are going to be missed by most other physical therapists. And we try and always relate it back to like a function thing. So if someone has pain in sitting, well, I'm going to test them in that sitting position versus laying flat on the table. And so it directs the exercises, and it's much more specific for that patient. And so I tend to get much better outcomes.
What's funny is that it almost feels, when you've done that for me, when you're testing muscle weaknesses in different planes and different axes, it's like you're zoning in like an MRI would. It's fascinating, because it's as if I'm understanding how the tendon is connected to the bone, to the muscle, etc. and where that nerve impulse is from the spine or elsewhere. And it really allows the patient actually to educate themselves with you. And that's part of the beauty of, I think, the experience with a practitioner who can take you along for the ride. It's not just you come in, hey, doc, hey, Dave, make me feel better. It's what caused this and why is it getting better while you're working on me, and then be able to nip it in the bud sooner in the future when they feel similar symptoms coming on. Would you agree with that assessment?
Absolutely. So.
And that kind of dovetails to the functional medicine world, because I've utilized you, Bojana, and other functional medicine physicians in my community to help patients that are struggling with the traditional approach to understanding their conditions. And we'll go through, perhaps if you could run through a list of the common symptoms and patients that you see. I know in my practice in the last 19 years, I've had a lot of help with patients that have irritable bowel symptoms, whether it's related to food allergies, whether it's related to stress, gluten intolerance, what have you, joint complaints, autoimmune disease, chronic headaches, sleep difficulty, stress and anxiety, not to mention a whole host of other conditions. I focus a lot on cardiovascular wellness, and there's a whole body of literature about how to improve inflammation in the arteries of your body that can decrease cardiovascular outcomes. So just give us an idea of the typical patient that has seen you over the last number of years and who has really benefited most from that functional medicine approach.
Absolutely. One thing I will say, though, that David mentioned that I hadn't, I really appreciate you saying that, because I hadn't thought about it in the kind of physical therapy way. But, you know, when you said, David, I don't treat just the body parts, I treat the person. That's kind of how I think about, I don't treat the problems, I treat the person. And yes, I ask people about their health goals. I ask them about their current health challenges. And of course, we have to have some sort of a system and framework in which we think about problems. But at the same time, we cannot forget that these are problems occurring in this unique individual with their unique set of circumstances, genetics, environmental triggers, habits, and so on and so forth, stressors. And so we really have to treat the whole individual if we want to do so successfully, rather than treat fatigue, treat hypothyroidism, or, whatever it may be. So I would say some of the most common, and as you, Jeff, right, being trained, in general internal medicine, right, it's such a broad area. And so I'm really fascinated, and I love treating people with all sorts of chronic conditions. I would say the most common ones that I see are thyroid disease, thyroid issues. So what I mentioned earlier, that small percentage of people that unfortunately they don't necessarily improve, even when their TSH has corrected, even when they're on the appropriate dose of, let's say, levothyroxine, they're just not feeling better. And so then figuring out, why are they not feeling better? What is their nutrient status? Is stress a factor in what's going on? Is inflammation a factor? Is their gut a factor? What else are the components of the picture that is influencing their thyroid function beyond just looking at our gold standard TSH? And while and I tend to see a lot of people that tend to be sort of either outliers in the sense that they've had chronic symptoms or chronic disease for a long time and are just unfortunately not getting those answers and not getting better in the conventional setting. Or I tend to see people who really want to optimize their health and wellness and are very proactive about, let's say they have a family history of whether it's autoimmune conditions, whether it's mental health conditions, and maybe they do have some anxiety that they want to figure out how to navigate in a more sort of natural way. I support people with that, and then a lot of people with gut problems. So I would say SIBO, irritable bowel syndrome. Those are some of the things that I see very commonly. And there are, I'm happy to get into kind of some of the things that I may do differently. But there are certain functional medicine tests that are available to do a little bit of a deeper dive into what's going on in the gut, what's going on with the gut microbiome. How did those bacteria then in turn influence inflammation, influence our symptoms, influence our gut-brain axis, and so on. And then I would say, besides hypothyroidism, gut health, and mental health, anxiety, insomnia, I think a lot of people with fatigue, joint aches, autoimmune problems, migraines, symptoms that haven't been either adequately treated, or they're just seeking for more kind of natural additions to their treatments so that they can be a little bit more proactive about reducing their symptoms in a more natural way.
Just give me a thought about, so if I come to you as a patient and I've got gastrointestinal issues, fatigue, whatever it may be, what are some of the tests that you run that may be different than a traditional doctor might do in their office that really hones in on what could be the root cause of the problem? You mentioned a few things there, screening for SIBO, if you can get a little bit more in depth with that, looking at nutrients and whether or not someone is deficient. That's something that many physicians either don't do or don't believe in the science of, and fear that all we're doing is giving supplements to patients that may not necessarily need it. So try to dispel some of those myths and give us an idea of what my visit with you might look like after that initial assessment.
Sure. So if we are talking about gut issues, right? So I would say some of the most common symptoms that people report to me when they come and see me are bloating, gas, abdominal discomfort, distension after eating food, and some type of bowel movement irregularity, whether it's more tendency towards constipation, whether it's tendency towards loose stools and diarrhea, versus alternating constipation and diarrhea. Now, I will say that generally this refers to chronic symptoms. So obviously, if somebody has more acute symptoms, the treatment would be different and the approach would be different if they're coming in with, 3 to 5 days of severe diarrhea versus if they're like, oh, I've had chronic on and off diarrhea for months and months and months, right? So in this case, we're assuming most people are coming in with these chronic symptoms. My workup largely obviously depends on what the symptoms are, what workup has been done before. So let's say some people might have already seen a GI doctor. They might have had a colonoscopy to rule out kind of, inflammatory bowel disease, cancer, sort of all of the things that are more severe and that really need to be treated right away. But let's assume that they've either had that workup or maybe their symptoms don't warrant that type of workup. After taking a very detailed history, which, I know my patients, when they first come to see me, they're like, whoa, those intake forms, but I really literally want to know everything about you. I want to know about your birth history. I want to know about your childhood. I want to know about your lifestyle currently. And so that's part of the sort of one of the things that I love and that I think patients really enjoy about coming to my practice is that I'm really genuinely interested in learning about them, because if I don't learn and understand them, their lifestyle, their circumstances, how am I ever going to be able to really zoom into that condition and appropriately support them with, knowing that there are multifactorial triggers to a lot of these symptoms. And so they'll fill out the intake forms. They'll share with me any previous lab work that's been done to reduce any risk of, redundancy and whatnot. And just like in collaborating with you, for example, their, primary care doctor might send over labs that they've had in the past and whatnot, just to eliminate any redundancy and just so that I can do all of my homework before I see them. I've already read their chart. I've already read their intake forms. So I'm not going in asking them the same question over and over again. So we can really sort of hit the ground running. And so once we do that and we assess for what their symptoms are, typically, if they are having a great deal of bloating, if they are having some changes in their bowel habits, I typically think about SIBO, because SIBO is one of the things that can cause a lot of bloating, and SIBO stands for small intestinal bacterial overgrowth. And so what we're looking for there is we're looking for overgrowth of these bacteria in the small intestine that really shouldn't be there. And there's certain things, we won't get into kind of all of the etiology, but there's certain medications, certain motility disorders, and other problems that can ultimately result in small intestinal bacterial overgrowth in someone. And that can cause a great deal of bloating, a great deal of just sort of lifestyle discomfort, because a lot of people can't, they're like, I can't plan, to go out for dinner. I can't plan social events because I get so gassy and bloaty and uncomfortable, or I can't fit into my clothes. And so it ends up really causing a great deal of distress for people. So the SIBO would be, the SIBO test is a breath test where and there's a kit that actually people can have shipped to their homes. So my office arranges all of this. So what they do is they drink lactulose, which is essentially the substrate that if they do have this overgrowth of bacteria, the bacteria ferment and they eat it up. And if they do have this overgrowth of bacteria, the bacteria will produce excess methane and or hydrogen gas. And so what we're measuring as the outcome is that patients over the course of 3 hours at intervals of 20 to 30 minutes will then breathe in so that their gases can be measured and assessed whether they have increased levels of hydrogen and or methane gas. And then based upon the test results, if they do have excess hydrogen or methane, we go ahead and treat. Now, we also look at stool tests in some cases where we want to have better insight into what the gut microbiome is like. But here we're talking about the gut microbiome in the colon. So further down, where really most of the bacteria live, 500 plus species. And I'm sure you know this, but there are more cells of the microbiome in us than there are of our own cells. So we really are just a host for these bacteria. So we better take good care of them and make sure they're balanced appropriately. But these bacteria are really important because they help us synthesize vitamins. They help us in the eliminating toxins. They help us not recycle our excess hormones such as estrogen and not reabsorb them. So it's really important. They obviously play a big role in mental health and obesity, inflammation, a whole host of things. So while we're still at the infancy of understanding the gut microbiome, and while these tests are still at their infancy and very much considered to be experimental and functional tests, we can still gain some insight into whether there are certain imbalances in either the products of the gut microbiome or the microbiome itself. And we can also gain some insight into whether there's inflammation in the gut, what the digestive capacity is in the gut. And oftentimes, if there are these imbalances, we can treat them and we can deal with them and kind of move on further. So those are a couple of examples of some of the tests that we do.
Give David an idea of the patients that you've seen with joint complaints that he may be treating. And this might be where this all kind of comes full circle. What other conditions should he be thinking of that might help him if he's having those tough to treat patients? Obviously in this area, we see Lyme disease more than we'd like. That goes without saying, but other conditions, perhaps SIBO or food intolerances or other toxicities, where if he's having trouble with a patient, when should he reach out to you with those individuals?
That's a great question. So, a lot of the times that, when we have those kind of more difficult to treat conditions and a lot of the times we start to think about, okay, multifactorial causes and these different triggers. So I would say whenever the symptoms appear to be out of proportion to your physical findings, there's something off, or out of proportion to the imaging, or out of proportion to what we can objectively all agree on. There doesn't seem to be any, let's say, joint destruction or anything that could point to, this level of symptoms. I would say, okay, consider other causes. Why is this person so sensitive? What is going on with their pain receptors? What is going on with inflammation that maybe we're not able to measure locally or systemically, again, depending on where the symptoms are. And then I would also say, typically when I do get patients who have diffuse joint aches, and let's say they don't have any autoimmune condition that we can find, and maybe their inflammatory markers are negative and we really can't figure it out. Oftentimes an elimination diet can be helpful in eliminating those symptoms. And I'll just give you a very straightforward case of myself. I've realize that if I consume excess gluten, I get a considerable amount of joint aches in my wrists and the joints of my hands. And it's nothing that clinically you would say, okay, this person has swollen joints, or this person, I don't have any positive markers of inflammation. But time and time again, I'm able to prove this on myself anecdotally. And I do have some patients that react in very much the similar way. And unfortunately, oftentimes we're so quick to dismiss and say, well, look, your markers are negative. Your joints don't look inflamed. What are you talking about? And so I would just kind of maybe tune into either those diffuse symptoms that where there are no obvious clinical findings, or just symptoms out of proportion to your findings. And then certainly if they report to you in addition to that, gut problems or other mental health problems, then I would definitely involve, a physician to further work that up.
Would migraine be something else that you deal well with?
Yes,
Yeah.
absolutely. Yes.
One thing that I just want to make a comment about both of you is that you don't need to see either one of these practitioners to understand how passionate they are about getting their patients well. I mean, it comes off the page to me, and I look at this all the time, and it's one of the things that I marvel about in our community. And what drives me crazy is that many physicians, the light has burned out in them. We talk about burnout all the time, and I really hate to see that, because I know there was a time when that physician was absolutely as passionate and compassionate as the two of you are right now. And it really speaks to the overall global sense of hopelessness that I think a lot of physicians have, and even physical therapists have, of this treadmill of seeing patients, of not being able to, if you're identifying yourself and your identity is your medical practice, and many of us, that's part of what our identity is, and you're having poor outcomes, or you feel you're not able to do it in the way that you want to, there is nothing worse than that feeling. It's the reason why I shifted over to concierge medicine. Patients might always laugh with me. They say, "Oh, Jeff, you shifted to this model so you could golf more." I'm like, initially I thought that might be true, but actually I golf about 100 times less than I used to, because I actually love what I do, and I have the ability to do it on days when I'm in the office, on weekends, on nights, and it's exciting for me, and I love that. And to be partnering with other practitioners in the area that think likewise and really have at the root of what they do every day to take great care of patients and to see them through this journey, I think that that's something that is fantastic, and I love it. One of the things that I would comment about is, over the past year, there's been a tremendous fear from a patient standpoint of seeing practitioners, right? Particularly physical therapists, David. So I want you to walk me through this past 14 months of trauma that we've all dealt with, and how were you able to sustain yourself? How were you able to convince patients that it was safe to come in? What precautions did you take to really make sure that that environment was safe? And maybe just give an idea of what you're up to now in terms of patients and the number of patients that you're seeing per day, and whether you're doing home visits, et cetera.
Yeah, so being hour-long sessions and being the only therapist here, it's nice because I can schedule time in between as far as patient transition, so people really aren't running into each other. And, I'm not 100% full where I'm seeing patient after patient every day, so I can leave, 5 minutes for transition time and things like that. And so it puts people at less risk. As far as what we're doing in the clinic, my thoughts being COVID is aerosol, so a HEPA filter being the number one thing that you can do to just reduce, viral particles in the air. And so combination of that, and then just masking. And I am vaccinated. I've been for quite some time, I think since January. And so it puts us at less risk, but still I continue to mask up with every patient, and even my vaccinated patients, we still mask up as well, just until we have better data on that, on when we will be able to unmask with other vaccinated people. And so I'd rather just keep that risk low, and so everyone's masked up. We do wipe down all the surfaces in between patients. I'll clean door handles and doorknobs and sink handles as well throughout the day. So yeah, basically combo of that. And then I do gloves. I did gloves for a long time. I know that the contact transmission is less, or significantly less than they thought anyways. And so I will do them on request at this point. But yeah, being vaccinated, and then even though I am fairly close quarters, having the HEPA filter in the room, and then, I'm not seeing 20 patients a day, and so my volume is low. And so, my risk is minimal, and people are very open and honest about their exposures to me, which I haven't had any direct exposures in my clinic, which is good. And so, if anyone is exposed, they, go through a quarantine based on their exposure if they're exposed. And so, it's been good so far. I haven't had any actual direct exposures where someone has come in with COVID, which is good. And as far as in-home physical therapy, patients, originally I had some patients that didn't want to come to the clinic, and so I do in-home anyways. And so I would go to their houses, and then we would do the same things, and then just crack all the windows so that there's good airflow throughout the room. And yeah, just use the same precautions. So I think that's the best you can do at this point in time, anyways, based on the data. So
I think that it's a selling feature, quite frankly, that you have fewer patients, that you're taking those extra precautions. Think about it in terms of the physical therapy volume-driven practice, where you're basically being asked to take risks in a sense. And I hate to say that, but it's true. If you're trying to get patient in after patient in, how can you take the same degree of risk that you're taking, the mitigating the risk that you're doing? I think it's just outstanding. And the concept of home visits is something that doesn't get enough play. Being able to sit in someone's home with them, and they're no longer a patient, they're a person that lives in a home that has pictures on the wall, the dog running by, the kids running by. It's just, I've done that for 20 years, and it's something that talk about reinvigorating you as a physician. There is nothing like seeing somebody in their home environment when the defense mechanisms are down a bit. You're able to really know them well. That relationship that you build over time. It's something that I know, David, you're asking someone. You have an hour with every patient. You're dealing with an elbow and a shoulder and an ankle, but you're really talking to the patient, getting to know them. There are so many times that our sessions are focused in on, how am I doing? How's my practice? How's my family? What other issues are going on? How's your health doing? I think that goes a long way. In a lot of the other settings that I've been to, it's, I got to go see Mrs. Smith and I'll be back in just a minute. Hang on, okay? We'll put that ice on there and the TENS unit and the heating pad, and I'll teach you some exercises later. It's night and day. I mean, I truly believe in this model. When I was reading their website, you said that there are only 254 alumni, at least at the time that you wrote it, that graduated from the Institute for Physical Art. And there are only 8 in the state of Connecticut, 4 of which you've taught. So, I mean, that says a great deal about your entrepreneurial spirit of saying, I want to do something different, and I'm going to take that extra time to get that training, even if it costs me money and costs me time, and if I'm working like a dog while I'm doing it, so that I can provide better care for the patients. Take me through that kind of a thought process. Were you scared, nervous to take a leap of faith and do that extra training?
no, I mean, self-improvement and advancement are something I think all entrepreneurial people do. And so it's comes with the territory, and learning is probably one of the things that I enjoy the most, and particularly learning about like the human body. So any of these courses, as I said before, I think having more tools in the toolbox and knowing when to use them gets you better outcomes, instead of, everything's a nail and all you have is a hammer. So going through the CFMT process was extremely valuable. It gave me a framework to treat people off of that pretty much works on anything. So I can treat an ankle, a shoulder, a knee, a hip, anything, because I can use that similar framework. And then through the years, I've added in a ton of extra skills as far as like manipulations like chiropractors do. I'm judicious on them. I don't overutilize that. I do dry needling, same thing. I use it when it's appropriate. It's not my prime mode where everybody gets, cracked and everybody gets needled, because it's not the tool you need for every single person. And so if someone's open to that, I use it and it gets good results. And then I've added on tons of other hands-on things like visceral work, which is mobilizing your organs. There's another system called fascial manipulation. That's where a lot of the muscle testing that I based it off of that system. Basically good for reducing pain and then getting muscles to fire again, so that you don't have as much compensation in the body. And so, adding to that toolbox is always the key thing. And I truly do enjoy learning to a high degree. And so it's always fun to take on new courses and just try and get better and better and better at what you do, so you can just get better outcomes for patients, because that's what it's all about. So
that's great. Bojana, during the pandemic, just tell me how you were able to interface with patients, and what your practice structure is like now that you've moved up from the New York City area to Fairfield.
Yes, so the pandemic has definitely affected us. And it's so interesting because I offered telemedicine prior to COVID, but I don't think that I or my patients ever thought that it would take on such a big role, and that we would be able to do so much by using telemedicine. And just to echo what you said earlier, although I don't see my patients in their homes, I do get to see their homes when they're doing a call with me from their house. And I just really love that personal aspect of seeing where they're at, what's their environment like, how much light is in their environment, do they like art, do they, I think it's just so telling and personal, and does allow for that deeper connection to be established, as opposed to in an office setting where there's just like the guard is up a little bit more, and so it is, no matter how comfortable we try to make it, we're still always going to be more comfortable in our homes. And so so I actually love that element, absolutely. But so my practice has transferred to mostly telemedicine. However, I still do see patients in office in Manhattan. And we have an office right by Madison Square Park on 245 Fifth Avenue, which is between 27th and 28th. And I use this space for each initial visit. Every patient, as part of their initial visit, I do offer a complimentary physical exam, so that I actually get to meet them in person. I get to examine them in person, but the talking still occurs through video visit, just because I think that both me and my patients really value so much having that time to talk without our masks on, and we can just kind of relax. And my visits are pretty long. They're 75 minutes, although I'm known to kind of go over a little bit at times. But so for those, I really kind of want to get to know them, to be able to have that conversation. I think people like the convenience of telemedicine, so I've kept it that way. So that initial is the 75 minutes via virtual visit, and then they have and then I ask people to schedule the complimentary physical in office. And then for any subsequent visit where I'm monitoring any physical signs or symptoms, anything where I really need to examine them, I have them come back to the office. But any other follow-ups that don't necessitate that physical encounter is done virtually. And so this is where the space is now. Down the road, I may have a space in Connecticut. I'm just kind of waiting for the pandemic to settle down even a little bit more, and then I'll start to plan something local. But I am available to patients here in Connecticut. I'm licensed here in New York, New Jersey, as well as California. So so thankfully, I'm able to see patients via telemedicine.
That's fantastic. I think maybe in closing, if both of you can just impart one tool that you can give to a patient to help improve their quality of life now, whatever that may be, whether it's something from a postural standpoint, David, whether it's something from a dietary standpoint or meditation or mindfulness, etc. What parting words would you have for them, regardless if they ever come to see you, that they may benefit from having listened in today to the program? David.
Yeah, I'd say work on your core strength. It's probably the most common thing we see is just deep core muscles are weak. And so, posture and core strength are probably key things that everyone should constantly work on. And so just body maintenance in general. So most of us sit way too much. And so we tend to get weak in consistent patterns that we often see. And so a lot of it is just back muscle weakness. So things like your rhomboids, your mid traps, deep ab muscles. And so people may do something like a Peloton, but you're still not going to work on those postural and those core muscles. And so when we get weakness, we tend to see compensation, and compensation creates pain. And so I think if I'm going to go with one piece of advice, that would be it. So keep your core strong and work on your posture.
How about you, Bojana?
So usually when people ask me what is the one health habit that everybody absolutely has to have, I answer sleep, because without our sleep, we're not able, study after study has shown, right, that it has negative effects on our immune system if we don't get enough sleep. It has negative effects on our memory, our cognition, our mood, the balance in our hunger and satiety hormones, right? And so there are a whole host of symptoms that are so dependent on the quality of our sleep that it's really, really important that we do get those. I say ideally 8+ hours a night. Some say 7+ hours, but I generally recommend 8+ hours a night. And if somebody is having trouble sleeping, it really is the number one thing that should be addressed. Even if you're not having any symptoms that I mentioned, it's still important to address it, because sooner or later, unfortunately, those symptoms will catch up with us. So sleep is the absolute number one.
I totally agree with you. I think what I would recommend is engage with your physician about your cardiovascular health. That may not necessarily be a tool to impart in your life. That gets into genetics and nutrition and exercise and weight and diabetes and high blood pressure. But I don't think we as a group of individual patients understand how significant cardiovascular disease is, stroke and heart attack. It's affecting a third of us. That's how a third of us will pass away, men or women. And that's an enormous number of people. And just because Lipitor is on the market, just because we check a blood pressure at the door, doesn't necessarily mean we're improving our statistics as it relates to these disease processes. And we know now so much more about heart disease than we did 20 years ago. And a lot of that data is driven by inflammation. It's not just about an artery getting blocked. It's about the artery being inflamed, allowing plaque deposition to then cause problems down the line. And that, I truly believe, has a lot to do with the glucose and the sugars that we eat, maybe even more so than the cholesterol that your doctor talks about. It goes into the inflammatory cascade of what's happening in your body. We talk about the microbiome. If your gut isn't healthy, your heart's not healthy. And I really believe that if everyone asked their physician to take a step further with looking under the hood a little bit more about your cardiovascular risk factors, whether that's identifying the advanced lipid tests that can be done beyond your LDL, whether that's doing a CAT scan of your heart to look for plaque. It's one of the things that's kind of changed my thinking about heart disease. I used to be a numbers-driven guy when I took care of my patients. I am now a plaque-driven guy. If I see plaque, the cat is already out of the bag. If I see plaque in your neck arteries, if I see plaque in the coronary heart arteries, we know, regardless of the numbers that are on the page at your physical exam, that some process has already begun. And so we need to be even more aggressive. So whether you're 40 years old or 65 or older or young, you really have to start to have this conversation now and ask of your physician if you don't get the right answer. And many times the answer that you get is, your cholesterol is fine, Jeff. I'll see you next year. And if you hear the term fine from your doctor at a physical, it means he or she doesn't have the time to really dive into what that word really means. And it's not their fault. It's the reality of the construct of the medical model that we have. And it's something that you should demand for more. And occasionally that means paying outside of insurance. And boy, do I wish my concierge model was covered, that yearly fee was covered by insurance. I truly, truly believe, I wish it was covered by your employer and covered by your insurance plan. Because if it were, the health of this nation would be 100 times better, and the health of each individual physician would be better too. Caring for a smaller number of patients means that you can care for them better and improve their outcomes. So that would be my parting word to the group. Lastly, I'd love to see where your thoughts are for where is the practice? Where is Bojana's practice going to be in 5 years? Where is David's practice going to be in 5 years? And let's not forget to tell everybody how they can reach out to you, whether it's on your website, phone call, etc. David, go ahead.
So yeah, I'm looking to grow the practice probably to one other therapist within the next year or so. And then I'd like to do a residency program. So I'd like to train young therapists to be much better therapists. I think it's one of the best ways to give back to the profession is just, pass on that knowledge that I've worked so hard to develop and hire someone else that can help me to do that as well. Yeah, I'd say if 2 to 3 years we can get a resident in here, and then long term I may consider moving towards like a teaching role, where maybe I teach some of the things that I've developed on my own, and so that would be like probably a 10-year goal or something like that. So
that's great.
As far as reaching me, my website is www.manualtherapyspecialists.com. The number here at the office is 203-557-9111. We'll put all that information at the end so everyone can have it. So
where are you located in Fairfield exactly?
Yep, 1300 Post Road. It is across from the Brick Walk, or most people in town know where 16 Handles Ice Cream is, and I'm above them. So get ice cream after you see me, if you guys see me.
That's great. Thank you, David. How about you, Bojana?
So in 5 to 10 years, I see my practice growing. I mean, I really think that this is the way that that medicine is going in. And I think that people are realizing that being more proactive about their health and searching for those answers and searching for those whys, as you mentioned, not being satisfied with being told your numbers are fine, but really understanding, what does this really mean? What are the factors at play? What am I at risk for? How can I change that risk? And so I really do think that our field is growing. I think there are more and more physicians that are undergoing additional training, and and there's greater patient demand. So I do see the practice growing and hopefully continuing to be available in multiple states, and bringing on other physicians and health coaches as well. And then I actually also used to mentor residents and medical students as well. So hopefully this is something that I can start doing when things are kind of back up and running in person, because I just so enjoy that. And I think it's so important to have good mentorship, and it's something that I've worked really hard throughout my profession, and I still do, seeking out people who are specialists in their field, they're knowledgeable about their field, and learning from them. And I think the three of us, we're clearly all going to be learning until we die. This is just kind of how we operate. And so I think it is important to continue to pass on what we know. In terms of how people can find me, so my website is drbojana.com. That's drbojana.com. And our phone number is 646-627-8000.
Fantastic. My name again is Dr. Jeff Puglisi. My practice is in Greenwich, Connecticut. It's called Glenville Medical Concierge Care. You can find it just by Googling Glenville Medical. Our phone number is 203-531-1808. We're bringing on a fifth doctor in August, and I'm super happy to announce her in the next few weeks. And she has a functional medicine background, and that was not by accident. I truly believe in what Bojana is talking about, that the next wave of physicians that comes out should really have this type of training integrated into their healthcare training in med school and residency. It's tantamount to being a good physician and understanding medical practice and how the body works. I'm gonna leave by just reading from Dr. Bojana's card that says 3 words on it. It says connect, learn, and transform. And I think that what we try to do today in the 45 minutes that we were talking is connect with our public, with our patients, with other practitioners, and let them know that we're here to help them take care of patients. I hope that we've educated and helped patients learn a little bit more about what we do and why it's different, cutting across the grain a bit from what the traditional physicians and physical therapists are doing. And then to help you to transform yourself into a better version of yourself, I really believe requires an intimate individual evaluation and experience with David and Bojana. I truly believe that. You're not going to get as much as you could from a video analysis. You really need to actually have David work with you and work on you, and have Bojana understand your past history and your genetic predisposition and some of those testing that she was talking about to get to that next level of health and wellness. If that's something that resonates with you, I certainly know it resonates with me, then please reach out to both of them. Thank you so much to Bojana and David for today. This was fantastic. Really appreciate your insights and hearing a little bit more about your journey. And hopefully we can do this again in the future. Thank you both.
Thank you so much.
Thanks, Jeff. Thanks, Bojana.